This is a healthy molar in a healthy tooth bed. And this is what the tooth looks like from the inside. There is the tooth with hard substances. It consists of the dentin structure, a hard tooth enamel cap, and bone-like tooth cement. The inner cavity is filled in with a nerve vessel netting, which is connected to an organism via a hole in the root tip and fed to the tooth. If caries appears on a tooth like this, it begins as a small defect in the tooth enamel, which expands rather rapidly into the underlying dentin. There is a reaction to heat, cold, or sweetness. Provided the decay has not spread to the tooth pulp, the existing hole can mostly be repaired with a filling or crown. If there is no treatment by a dentist, the tooth decay then moves into the tooth pulp, resulting in inflammation of the sensitive tissue. Due to a lack of blood flow in the inflamed region, the tooth pulp dies. Severe pain usually occurs now, and a root treatment becomes necessary. The tooth is opened. The nerve must almost always be removed to treat the inflammation, and the root is filled with pharmaceutical filling material or gutta percha, the thickened sap of a tree in the Far East. Saved. The rigorous root treatment has prevented a granuloma or cyst. The diseased tooth could thus be preserved. Let's see what happens next on a front tooth. A high-tech example. A mineral fiber pin with epoxide resin reinforcement is attached in the root canal with adhesive technology. A tooth core is formed from a structural composite in which tooth substance that may still be present can be included in the structure. The structure is prepared in exactly the same way as that required for the inclusion of a crown. If these teeth had not been preserved with root canal treatment, a fixed tooth replacement in the form of a bridge would no longer be possible. And that takes care of modern composite structures in this process. With individually molded precious metal root structures which were submitted into the tooth root, teeth whose roots had already been treated could be successfully restored. Another good solution is based on industrially manufactured titanium pins. They are screwed into the tooth root. The titanium anchor also has a core structure for the inclusion of a crown. This method is also very widespread nowadays. So, thanks to these small, sharp, and delicate precision instruments, your dentist can preserve a tooth with a diseased root with excellent chances of success, and restore them with the aid of modern materials.